This multivitamin product is used to treat or prevent vitamin deficiency caused by a poor diet, certain illnesses, or during pregnancy. Vitamins are essential for the body and help maintain good health. When taking Century Mcg-50 plus 300 Mcg-60 Mcg-600 Mcg-300 Mcg tablet, it is important to follow the instructions provided. Typically, it is taken orally once a day, or as directed by your doctor. It is crucial to adhere to the recommended dosage and not exceed it. Taking this medication regularly at the same time each day will help ensure that you receive the maximum benefit from it. If you have any questions about how to take this medication, it is best to consult with your doctor or pharmacist. Some common side effects of Century Mcg-50 plus 300 Mcg-60 Mcg-600 Mcg-300 Mcg tablet include constipation, diarrhea, or upset stomach. These effects are usually temporary and may go away as your body gets used to the medication. If any of these effects persist or worsen, it's important to consult your doctor or pharmacist. It's important to note that if your doctor has prescribed this medication, they have determined that the benefits outweigh the potential risks of side effects. Many people who use this medication do not experience serious side effects. While rare, a very serious allergic reaction to this drug can occur. Seek medical help immediately if you notice any symptoms of a serious allergic reaction, such as rash, itching/swelling, especially of the face/tongue/throat, severe dizziness, or trouble breathing. It's important to keep in mind that this is not a complete list of possible side effects. If you experience any other effects not mentioned here, it's important to consult your doctor or pharmacist. If you are in the US, you can call your doctor for medical advice about side effects, or report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can call your doctor for medical advice about side effects, or report side effects to Health Canada at 1-866-234-2345. When taking a multivitamin containing iron, be sure to keep it away from children to prevent accidental overdose. Iron overdose is a leading cause of fatal poisoning in children under 6 years old. If an overdose does occur, seek medical help immediately or contact a poison control center. Before taking Century Mcg-50 plus 300 Mcg-60 Mcg-600 Mcg-300 Mcg tablet, it's important to talk to your doctor or pharmacist about any allergies you may have to its ingredients or to soy/peanut found in some brands. This product may contain inactive ingredients that could cause allergic reactions, so it's crucial to discuss this with your pharmacist. It's also important to inform your doctor or pharmacist about your medical history, especially if you have a history of alcohol abuse, liver problems, or stomach/intestinal issues such as ulcers or colitis. If your multivitamin brand also contains folic acid, be sure to discuss any vitamin B12 deficiency, pernicious anemia, with your doctor or pharmacist before taking it. Folic acid may affect certain lab tests for vitamin B12 deficiency without treating this anemia, which could lead to serious nerve problems. It's important to consult your doctor or pharmacist for more information. Before undergoing any surgery, it's crucial to inform your doctor or dentist about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. If you are pregnant or breastfeeding, it's important to discuss the use of this medication with your doctor. This medication passes into breast milk, so it's important to seek guidance from your doctor before breastfeeding while using this medication. It's important to be cautious about potential drug interactions when taking Century Mcg-50 plus 300 Mcg-60 Mcg-600 Mcg-300 Mcg tablet. Make sure to keep a list of all the products you use and share it with your doctor and pharmacist. Certain medications like antacids, bisphosphonates, levodopa, thyroid medications, and some antibiotics may interact with this multivitamin, so it's best to consult with your healthcare provider about how to space out your doses. Additionally, if your multivitamin contains folic acid, be sure to inform your doctor or pharmacist if you take certain anti-seizure drugs. It's also important to let your lab personnel and doctors know that you are taking this medication as it may interfere with certain lab tests. If you or someone else has taken too much Century Mcg-50 plus 300 Mcg-60 Mcg-600 Mcg-300 Mcg tablet and are experiencing severe symptoms like fainting or difficulty breathing, call 911 immediately. Otherwise, contact a poison control center right away. In the US, you can call 1-800-222-1222, and in Canada, residents can call their provincial poison control center. Symptoms of an overdose may include stomach pain, nausea, vomiting, and diarrhea. Always seek medical help if you suspect an overdose. Be sure to attend all your medical appointments and laboratory tests as directed by your healthcare provider. Certain brands of this medication may also include additional ingredients like docusate. If you have any questions about the specific ingredients in the brand you are using, don't hesitate to ask your doctor or pharmacist. It's important to note that this product should not be used as a replacement for a balanced diet. It's always best to obtain your vitamins and nutrients from healthy, whole foods. Be sure to maintain a well-balanced diet and follow any dietary recommendations provided by your doctor. As always, consult with your healthcare provider for the correct dosage and timing of Century Mcg-50 plus 300 Mcg-60 Mcg-600 Mcg-300 Mcg tablet. If you've been prescribed Century Mcg-50 plus 300 Mcg-60 Mcg-600 Mcg-300 Mcg tablet and happen to miss a dose, take it as soon as you remember. However, if it's close to your next scheduled dose, it's best to just skip the missed one. Never take a double dose to make up for the missed one. Stick to your regular dosing schedule. Make sure to store Century Mcg-50 plus 300 Mcg-60 Mcg-600 Mcg-300 Mcg tablet at room temperature, away from light and moisture, and not in the bathroom. Keep it out of reach of children and pets. Remember not to flush this medication down the toilet or pour it into a drain unless specifically instructed to do so. When the product is expired or no longer needed, be sure to properly discard it. You can consult your pharmacist or local waste disposal company for guidance. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.